I'm Dr. Mangesh Kamath. I'm a senior consultant medical oncologist, hematologist and bone marrow transplant physician at Healius Cancer and Hematology Clinics, Bangalore. A large part of my practice involves treatment of children with cancers. So the most common cancers that we see in children are leukemias, brain and spinal cord tumors, neuroblastoma, Wilms tumor, lymphomas, rhabdomyosarcoma, retinoblastoma and bone cancers. Now most of these cancers are curable when detected in the earliest stage. And this is the theme of this month where we observe World Childhood Cancer Awareness Month. Every year in September, World Childhood Cancer Awareness Month is observed to educate you all about what is unique about cancers in children. Children do not have a prior exposure to alcohol, smoking, harmful chemicals of the environment, obesity, sedentary lifestyle and so on and so forth. Then why do millions of children get cancer? That is a question that you must all be asking. The most common answer that I give to families of children affected with cancer is that there is a huge bad luck factor. Many of these children with cancers have genetic mutations or genetic abnormalities which gets manifested as cancers. For example, leukemias. Leukemias account for almost 30% of all cancers in children. And the most common types of cancer is acute leukemia, which can be divided into acute lymphocytic leukemia and acute myeloid leukemia. Now, these leukemias can grow very quickly and they can be treated with the best of treatment, and the highest chances of cure can be enabled by treating the latest standard treatments. So it makes it very easy for us to treat all of these cancers if they present to us at the earliest phase, because cure rates are also a lot higher. Brain and spinal cord tumors usually present to a neurologist or a neurosurgeon, and most of the time these children have headaches, blurred visions, vomiting and seizures. And when diagnosed early and if a good surgery is possible, followed by radiation and chemotherapy, many of these brain tumors and spinal cord tumors can be cured. Neuroblastoma is a cancer that is unique to children, wherein there are cancers in the early forms of the nerve cells, and they can develop as early as inside the mother's womb. And this type of cancer usually develops in infants and young children. It is very rare to have children above the age of 10 getting neuroblastoma. But again, if it is detected early enough and treated early enough, neuroblastoma can also be cured. Wilms tumor is a type of tumor that is very commonly seen in kidneys of young children between the age of 3 to 4. It is very uncommon again in older children and adults, and it again presents as a lump in the belly, and if diagnosed early, definitely is one of the most curable cancers in children. Lymphomas, basically these are cancers of the lymphatic system or the immune system in our body. They start in lymph nodes and other lymphoid organs such as the tonsils and the thymus, and they also are extremely common in children. The most common subtypes of lymphomas are Hodgkin's lymphoma and non-Hodgkin's lymphoma. This lymphoma can occur even in adults, but there are specific subtypes of lymphomas which occur in children. If they are detected early, again they are the most curable of cancers that we know in children. Next comes rhabdomyosarcoma. which is a type of cancer that develops in the skeletal muscles of the children, and this again can start in the youngest age, and when treated well, rhabdomyosarcoma is extremely curable. Retinoblastoma, it is a type of cancer that is seen in the retina of children. Again, most commonly this type of cancer presents around the age of 2 years, maximum around the age of 5 or 6 years, and this is usually noticed when a doctor, a pediatrician, looks into the eye of the child and gets to see something unusual in the child's eye. And if it is detected early, again there are amazing treatment strategies available to cure retinoblastoma, and the best treatment given at the earliest can make a great difference to the outcomes of retinoblastoma. Last but not the least, bone tumors. Bone tumors are very common in older children and teens, but they can occur in a young age as well. And the most common types of bone tumors that we know are osteosarcoma and Ewing's sarcoma, and they are usually seen in growing bones, and it is very common for them to be detected at the earliest stage because it is they usually present with bone pains and bony swellings, and if treated early, cure rates are extremely high. So folks, childhood cancers are presentable at the earliest age. Number 2, most of them are curable if diagnosed at the earliest stage, and also if they are given at the best treatment at the earliest phase. And 3, please be aware of any changes in your child's body and present to an oncologist or a pediatrician at the earliest, so that any of these tumors can be diagnosed at the earliest phase and treated well. Thank you.